Alright, so hi guys, welcome back to Your Healthcare in Your Hands. I am here with Emily, my sister, newly engaged Spartan enthusiast, Spartan trifecta.
That's true.
And a licensed counselor for drug and alcohol. Currently working for behavioral health insurance. Awesome. And she got her master's from Chestnut Hill in clinical psychology. So she's going to be talking to us a little bit about mental health today. So why don't you tell us just a little bit about what you do?
So I work for a behavioral health insurance company, and basically my job that I have right now is for a certain population of higher risk kids. So rather than just have anybody be able to review their treatment that they're getting, they have one person that kind of follows them through, offers more support to people that are actually offering them the service to make sure that they're kind of following the standards and guidelines that they should be.
Okay, because when you said insurance, I was like, okay, you're doing like the coding, like this insurance kind of thing? Okay.
So it's I think that's what most people think of when they think insurance. But like everyone that works where we work, we all have to be licensed counselors. So we've all been in the field at some point.
And you actually get to work with the clients or the patients like one-on-one at any point, or?
Mine a little bit more, just because of the fact that like my caseload is actual members as opposed to a level of care, where other people just like manage a level of care. I don't typically work one-on-one with the members, but I'll work one-on-one with their therapist to be like, all right, what's going on? What barriers are you hitting? Do we actually think that this is helpful for them anymore, or should we brainstorm other services that they could have?
Cool. So what are some of the services that you see like kind of helping a lot of people, or that you kind of recommend a lot?
It all depends on the person. The insurance company I work for is all Medicaid, so it's all county funded. So sometimes the barriers with that is we don't necessarily have as many options for everything. So we've been trying to expand the network. So like we have art therapy in our network now. We have music therapy in our network to try to open it up to as many supports that there can be, to make it as unique to that individual. For children's services, there's a lot of, we have like family-based services that works with the entire system. They have what's called behavioral health rehabilitation services. So that has typically like a 3-part component where there's a mobile therapist, a behavioral specialist, and then there's, they call it DSS. They're basically the ones that work like one-on-one with the child to kind of help transfer those skills. So those are the ones you see the most for kids. And then you have like the residentials where unfortunately they're there like a 24-hour level of care. A lot of the members I work with have been there at some point because they're seen as the higher risk ones.
Okay. Alright. So when you have people that are coming in and kind of going through these different, options, so what kind of like stigmas or ideas do they come in with? Do any of them like come in like completely hard-headed, like we're not going to do this, we don't want to do this, we don't need this, or are they, I guess, more accepting and open?
When I was doing direct care, it could be both. I think the biggest thing is, because I've always worked with children, that their families just wanted you to fix my child and didn't necessarily want to participate in the treatment. So that was kind of the piece that made it difficult, because they live with you, they interact with you, so like you kind of need to learn what's going on and how to work with it. I think the biggest thing with what I work now is everyone thinks that because it's insurance, it's all about financial. So they don't understand that like we're actually trying to make sure that it's like the most appropriate level of care, so that what's being paid for is going to help you. Because just like everything else, like there's not just an infinite amount of money.
Right.
And ours is a little bit different because it's all the county funding. So basically the county delegates to us, here's our money and you're responsible for managing it.
And you work in PA, right? So that was one thing I realized because I had been in Delaware and had Delaware Medicaid.
Okay.
And it was like very open and inclusive. I think I got it originally while I had a job and actually dad's insurance. So I was technically covered.
Yep.
And I still was able to get it just because I had Savannah. When I moved into PA, it was like a totally different story.
Yeah.
I was like, I don't even have a job yet. I just need to file for some insurance. I have a child. Like, and they're like, no, you make too much. And I'm like, I don't have a job though. How am I making too much? I haven't gotten my job yet. Like,
but
so
it depends. So like for this, it's not even just financially based. It's anyone who, like a lot of the kids, and we have certain families who, it's not because they don't have the money to pay for insurance.
Yeah.
It's because certain services are only county funded. So like there's certain people that like you need to have the county funding in order to have those services.
Oh wow.
Mm-hmm.
How much of the percentage is it that's you need to have the county to be able to get them?
It's not a ton. Like we like family-based services and the behavioral health and rehabilitation services. Those are just county-funded services.
Oh, wow.
And it's also, I mean, it's for people that you can apply for if you have just certain diagnoses. Like you can have it. So it's not just a financial, although many of the people that do have it can be considered like lower income, but it's just about not necessarily Social Security, but like kind of lining it up with that like there's something going on that you are deemed that you could benefit from the extra support.
Awesome. That's actually really good to hear though, because there are so many people, because even regular insurance, like private insurance and all that, they don't always cover like mental health at all. It's like you have to fight for it.
And with this, anyone who has the Medicaid, they can't be charged anything.
Okay.
So there are no co-pays.
Yeah.
If there's like a leftover balance or whatever, like no one that has our insurance, it can be held responsible financially for any of them. So that means that not necessarily every provider wants to be in network with you, but it is kind of that protected piece where like any treatment that they get is 100% covered through the insurance, so they don't get impacted by it.
Well, that's good. It makes me feel so much better because I hear so many stories where it's like, you know, they needed some kind of mental health issue or they didn't need the issue. They needed the help for it. Yeah. And it's like they get put where it's like you have one option and this is the only thing you're allowed to do. Nothing else is covered. And even this option, it's like, well, you're still going to have to pay like all of this out of pocket. And it's hard to like hear that. It's hard to like accept that as that's like a reality. So what are some of the things that you see when coming in as far as stigmas? I know you said like some of the parents, sometimes it's hard for them to understand that like this isn't just like fix my child. Is that the only one you see or is that?
I mean, I think in general it's being a little bit more accepted, but there's still kind of that shame around it. People don't want to necessarily talk about it. They don't understand that like majority of us have struggles and things that we're dealing with and like it's okay. I think we're shifting away from like in mental institutions, but I think that's still kind of that feel. So like they don't realize that it can just be as simple as like you can have anxiety and like there's a lot of people who have anxiety and we deal with it on a daily basis and like it's fine. Like I have anxiety. You look at me and you don't see like the mental health patient.
Right.
So, I mean, I think it's coming around, but there's still that piece. And, like, if medication is a whole other, some people just want the magic pill that's going to fix it. And then some people are so afraid that, like, what does that mean if I have to take something?
Yeah. There's like, there's the stigma with the pill that it's like, well, now I'm on medication. And then there's also, just because of, like, experience, like, a lot of people that are coming from, like, a drug or alcohol problem that then end up in, like, we need to take care of some mental health issues. They don't want to take the medication because of, you know, their past. So, I mean, because I've always been the same way, like, medication, I'm like, no, like, I can't do it, like, keep me away. But, I mean, honestly, it really is, like, you have to be able to take into consideration what you need to get done, and because there's so many, like, negative stigmas about going to see a therapist, or, like, you know, the nut house, like people shy away from it and they don't even do the research a lot of times, like to know what there is. But yeah, so I guess we'll go through some of these questions. What do you think of the current healthcare system we have in our place today in our country? And then why?
I mean, I think the biggest downfall that we have is people just don't understand it. They don't understand the benefits that they have. They don't understand how to find the help that they need. So that's what I think is the tough part. I mean, like, yes, there is a huge financial factor to it now that limits people being able to get the help that they need, whether it's mental health or physical health.
Yeah.
But what I feel like I hear a lot is people just, they don't understand their benefits. They don't know what they actually get with their benefits. It ends up just being money that they spend and they don't know how to use it.
I don't even know it covers my insurance plan. I have no idea at this point. He, like, Tom understands it, and he'll be like, oh, you know, this or that. I'm like, whatever you said.
Yeah. So, I mean, I think that's the toughest, and you don't necessarily get a whole wide variety of it. If you're getting it through where you work, it's whatever your work offers, and you're trying to figure out which one makes the most sense from the two, maybe three that you have to pick from. So I think that's where some of the downfalls of it come in.
And I like that you brought in, like, people don't even know, and I think that's a huge thing is exposure. Like, if you turn on the TV, you will see, 5 million different commercials for every, like, prescription under the sun.
Yep.
But you never see something about, like, a chiropractic office or, like, a Reiki or whatever it is. And I'm just like, no one even knows that it's an option. No one even knows it's available to them or, like, what benefits could be. So, I mean, that's one of the reasons I'm doing this. I kind of want to really just get the word out. There's options out there. You don't have to, like, just go do this one route. But it does become hard with insurance companies and, like, trying to figure that out. Do you see any, like, changes in that direction for insurance companies that would include, like, more holistic practices, or?
I mean, I think that that's what they would like to try to do. From mine, I do strictly behavioral health, so it's a little bit different. I mean, they have, like I said, we've tried to bring in, like, musical therapy and art therapy to expand it. I think the physical health end has expanded somewhat. I know, like, there are some chiropractors that can accept insurance, and you also have to know how to build insurance. So it's a piece where, like, you need to know what questions to ask, or be going to someone who knows enough to say, like, okay, well, this is how this has to be written, so that they know that, like, it's not because you're just coming to me because you want to come to me, you're coming to me because this would benefit your life.
Right.
So that's a struggle too, because then it's them doing extra work rather than just being like, okay, pay me your X amount of money for the session we just had.
Oh, wow. So yeah, I guess, like, knowing what it is, knowing who to go to that's going to know what to say or what to write. I didn't even think of that. But yeah, I guess that's, like, a really big part of it, like, making sure that you're going to someone who knows, I guess, what your intentions are going to be, and, like, knows how to set that up for you.
Yeah. And I mean, doctors have to know how to do that too. Like, when they're writing you a prescription, they have to know how it can be written and why it needs to be prescribed that way, so that you can get the insurances are going to say, well, wait a minute, why are you trying to refill this sooner than you should be?
Okay, well, yeah. I'm like, mine is opening. So
and I mean, I don't think about it until you have, like, birth control can be one of the things. If you're taking it because of the fact that you have cramps, or they're actually trying to help you during that time, and you're not just taking it for actual birth control.
Yeah.
The whole point of taking it is so that you're getting that hormone.
Yeah.
Well, if you go through that week period of time where you're not getting that, that's usually when you're experiencing more of the pain and those kind of issues. So part of what they'll do is your doctor will write the prescription so that you can take it, you continue to take the pill during that off period.
Okay.
But an insurance company would block that because they would think you're trying to refill your prescription sooner. So your doctor has to write it as, this is for pain management, or this is for whatever it is, so that it can be okay. And then the insurance, it's not like the insurance company is purposely trying to keep you from it, but, like, there has to be a reason, and you have to know what that reason is.
Yeah.
So that they can get it.
See, I ran into that once, but that was completely, I don't think it had anything to do with insurance. I think it was because I was in a Catholic hospital, and my OB was like, you know, we can't give you birth control, but we can give you cramp stuff. So that's like how they wrote it off, as like it was specifically just for like cramps and whatever. I was like, okay, whatever gets it done, you know. Right. But it probably happens to like a lot of people, and at least I didn't know that it was like specifically for one or the other. I mean, I kind of assumed Catholic hospital they can't give you. Right. But yeah. All right. So, I mean, we kind of talked about a little bit about like misconceptions. Are there any like popular misconceptions about your job we haven't touched on?
No, I mean, I think the biggest thing is people have a very negative view of insurance companies, and I get it. Like, I've been there and I felt like, well, why is the insurance company dictating the care that we can get? Why will the insurance company only pay for this amount of money and then I'm being stuck paying for the rest of it?
Yeah.
The financial piece, as far as like how much the person ends up being held responsible for, that also goes back to the physician's office, because they're the ones that come up with the prices. Insurance companies say this is how much we pay of that, and it's up to whoever did that service to decide, okay, how much do we hold the person responsible for. Sometimes what will happen is they can set, an insurance company will almost say like, this is the max you're allowed to charge for this.
Okay.
So then there still might be a leftover amount, but it's not as exorbitant for a person to be held responsible for after it. But yeah, and it's not, at least when it comes to behavioral health, and especially where I work, like, it's not about the money, it's just about making sure it's the right service, because you don't want someone to be getting treatment for the rest of their life. Like, that's not fulfilling for them. So let's make sure that the service that they're getting is appropriate, is helping them and moving them to the path where they don't need it.
I'm glad you said that, because I feel like a lot of people, they go in, that's one of the stigmas with it. It's like, they assume that, oh, if this is wrong with me, then it's going to be there the rest of my life. And I'm like, but that's the point of treatment, you know? Like, it's the same thing as like if you have like the cold or the flu or whatever, like you go into the hospital, you go to your doctors, you get the medication, and then it goes, it passes, you know? Like, you have to go through the treatment in order for it to pass. But there's, I guess, so many instances of people who didn't go get help. And so it was like an ongoing, lifelong problem that it's just kind of assumed that it's going to be there. So.
Yeah, I mean, the whole point of therapy is to help people learn how they can manage it on their own.
Yeah.
And sometimes they do need lifelong, some kind of support that's in there, but you kind of end up with the tools. It's like if you have diabetes, it's something that's lifelong and you'll be managing, but you are given the tools to do it so that it has the least amount of impact on your life. It's the same thing with mental health.
Yeah. It's crazy though, because people really don't get that. And they, like, the thing I run into the most is that like fear. And like you said, it's not always from the patients themselves or the kids especially, like it's from the parents. Like I know, so when Savannah was born, I had to do a lot of occupational therapy. They told me she had cerebral palsy, and they're like, you have to do all this stuff, and occupational and physical therapy. And like to me, it didn't seem like a lot. But then like later on, we were told about like she should be seeing a therapist and she should be doing, and immediately my head went into like complete like opposite of where I had been like when she was born. I had to do it. I was like, it's therapy and therapy. Like one was just physical and one is mental. So why is there like such a big difference? But I mean, I've been doing therapy. She's been going to therapy. We're all like in therapy now, and I'm like, it's awesome. Everyone should be in therapy. Like I feel like the California idea of like where everyone has a therapist, I'm like, they need that worldwide.
Because you don't just have to see a therapist because there's something wrong with you. You can see a therapist. It's about self-exploration, really. Like it's about being the best you.
Yeah, that's kind of what I got in. Like why I started getting into it is I did my what was it? The 200-hour yoga, and it was so much self-exploration that I was like, I know way too much about me. Like, what do I do with this information at this point? And so training was over, and at that time they didn't actually have a 500-hour, like the next step for it. So I was like, I don't know where to go with this. Like, I don't know what to do with this. And that's why I ended up kind of doing that. So I was like, I can't just guide myself through all of it. Like, I'm gonna get lost in my head. But yeah, I mean, for me, that's kind of what happened. Is I found someone who was able to help me guide through my mind. It was pretty much what it was.
Absolutely.
All right. Okay, so what are some of the biggest problems or concerns that you have with the healthcare system today? And then do you have any possible solutions?
I mean, I think at this point it's just the financial piece. There's people who can't afford to go get the treatment that they need because of whatever the copay is going to be, or there's pretty much a deductible on so many of the plans now. So it's like you can't go and get a test done because you're responsible for all of that until you hit your $5,000 deductible. Well, people don't necessarily have that out of pocket to put out. So I think that's the biggest thing. I think that just prevents people from going and taking care of things that they need to take care of because they don't know how they're gonna pay for it.
So what are your thoughts on like universal health care then?
I mean, I think that it's, I think it's something that could be a possible solution. You hear positive and negatives. I think there's going to be positive and negatives to anything that we do. Making it readily available to everybody, I think, is a good thing. Kind of having so it's a set standard of what pricing and everything is can be a good thing. My fear sometimes is you start to get cookie cutter. And that would be the only kind of concern that I would have is like everyone has to fit into this box because this is what we can offer, and it's a positive with how it can be offered to you that it makes it kind of more open to everybody, but it may not meet the need of every person.
Yeah, I can see that. Because I hear so many people that are like, oh, universal healthcare, like it's amazing, Canada, let's move there. But I didn't even think of that.
Well, and truthfully, like I'm pretty ignorant on it. Like I hear that it sounds great, but like I don't live in Canada and I don't have that as my treatment, so I don't know what that would look like.
Yeah, but that is one thing that I don't think I've heard anyone say that is like that cookie cutter, and it makes sense because that's exactly what we fell into when we had like the big hospitals and the big practices, and then when we started kind of like putting the insurance like this is how it has to be, this is what you have to do, then we started opening private practices. And then the private practices all kind of just ended up mimicking anyways and like doing the exact same thing. So it kind of became cookie cutter the same way. So I guess that would, I don't know. Do you have any ideas as to like what we could do or no? Haven't thought that way?
I mean, I think with certain things that they've been trying to do, I mean, I know there's a lot of, some people loved it, some people hate it with the whole Obamacare that came in. I think some of the things that were trying to be done as far as like your yearly physicals were 100% covered. Your every 6 months when you go to the dentist, when you do your yearly going to see the gynecologist, like I think that is something that's moving in a positive direction. It just takes so much time to put that kind of reform in place. But I mean, like I see those kind of things, the preventative, if we can put more of that in place, I see as being a good first step because if we can catch it before it becomes an issue. But again, even with that, like I've heard people are afraid to bring things up when they go for their yearly physical because if it ever gets coded then as there was a problem that was being addressed, then you get stuck paying for it.
I've definitely been part of that group. Like, they ask me the questions at the doctor's office for my physicals, and I'm like, nope, I'm clean as a whistle, everything's perfect, like, picture of perfect health.
Take my blood pressure, let's do my lab work, because that gets paid for, and then let's move on.
I think the only time I'm truthful with doctors is if I'm, like, in the hospital and, like, something's wrong. At that point, I'm like, yes, I'll tell you my whole life story. But, no, with, like, physicals and, like, the years, I'm like, no. You don't get to know, and it'll go straight on my insurance, and then I get billed more, like, so, but it's definitely, but the preventative health is something I think that in general, it's definitely moving in a better direction. It's something that I want to see, like, just more of in general. Because, I mean, that's, for us, in our house, that's what keeps us from getting sick. It's, like, making sure that we are doing everything we can to, like, eat healthy, take our vitamins, make sure that, like, everything around us is clean, and so, preventative is
huge. And those are
huge.
things that could be, I mean, typically only your medications get paid for by insurance, but if there's stuff like vitamins that could go on those plans, like that would make such, to me, that starts to fall under that preventative, because if we can put those that increase your healthy living, then hopefully you're decreasing, I mean, obviously there's certain things that we can't necessarily control, but like, if we don't end up with the flu, that right there is a big, if we
I
look
mean,
at the
huge.
finances, like that's a cost saver.
Oh yeah. I was reading a study about where, it's actually funny that you, because vitamins, so I guess it was millennials and, I think it was the greatest generation and baby boomers. If you looked at what was in their medicine cabinet, it was like all vitamins.
Mm-hmm.
And then generations after that, it was like just the prescriptions. It was like, it was the after effect, the repair work rather than the maintenance work.
Mm-hmm.
So I guess if we could get more people to, I guess of our generations, to actually start taking vitamins and supplements, it could like have some kind of impact. But there's so much, especially with the FDA, that they don't regulate it. So, I mean, I run into it with, I have the oils and all.
Yeah.
But I'm like, when people ask me, I'm like, well, technically the FDA doesn't certify any of this. Like, I can't say that it's going to be good for anything.
Right.
But yeah, if we could get more people to actually start paying attention to the preventative health, to the supplements, to the vitamins, and getting that kind of like implanted in people's heads, like this is what you should be doing instead of, you know, always having to backpedal and fix the problem instead of trying to maintain it, make sure it doesn't happen in the first place. Yeah, preventative health is huge.
Yeah.
What are some of the things you do for preventative health?
I mean, for me, I go to the gym at least 5 days a week to try to, I mean, that's my mental health and physical health, to try to do that. I take my vitamins, try to eat healthy and eat balanced, try to sleep. Sometimes easier said than done. But it is like just trying to make sure that your daily needs are met.
Oh yeah.
And paying attention to like yourself and your body and when you're starting to get out of whack.
So what are your thoughts on self-care then? Because I hear like it's all over social media, self-care, bubble baths, all that. What are your thoughts on that?
Self-care is so important. It's just you have to know what self-care really is. And what that means to you. So it's individualized for every person. What I usually try to talk to people about is like it's about taking time for you. So if it's the bubble bath that does actually make you feel relaxed, then like yes, that's what you go and do. But it's not just like, okay, I'm gonna go sit in a bubble bath. You know, like if that doesn't do anything for you, then there's no point in doing that. But people will use it as an excuse. You know, I'm going to go on a shopping spree and this is self-care.
Yeah.
Well, is it? I mean, like every now and then if like you feel really like fancy or special because you got to go buy a new pair of shoes, like that's awesome, go for it. But it's usually what you need in that moment.
Yeah.
So like I would talk to people when I was doing direct care about like, it's just about listening to yourself. So like if you're feeling really tired right now, maybe you don't need to do the dishes. Like maybe you just sit down.
Yeah.
Because what really happens if those dishes don't get done like in this moment? So like it's stuff like that that can really be self-care.
Awesome. That's when I see all the time, and they're like self-care, taking a bubble bath, or self-care, and I'm like, self-care isn't always fun though. Like sometimes it's like really painful and hard and you don't want to do it. And I have to like force myself to sit and be like, all right, we're taking time, we're gonna journal, we're gonna like go through whatever's hurting.
Yeah.
And I tell people this and they're like, that doesn't sound like it was very caring for yourself. And I'm like, in the long run, it will be.
Yeah.
Right now it's gonna hurt, but like in the long run it'll be fine. But that's one of the things I'm like, when people brag about all this self-care, I'm like, but you don't know what it is, and we're getting like misguided with all of this like just chatter coming through, like this is what it should be, this is what it is for me, so it's like that for everyone. No.
Yep.
So alright, so what do you think is number one of all the biggest problems, or what would you change if you could change one thing today as far as healthcare?
Honestly, I think one of the things that could be most helpful is having there be like insurance advisors. Like you can have a financial advisor that helps you plan for your current financial needs, your future financial needs. No one understands their insurance.
Yeah.
So like I think that could be the biggest thing to help you, like what actually works for you, what would be most helpful for your lifestyle and what it is, and then how you use it so that you can benefit from it.
That'd be awesome. I would definitely hire an insurance advisor because, like I said, I don't don't have the slightest idea.
No.
The only time I ever knew what my insurance offered me was when I actually had Medicaid. And that's because they would send out a packet like every month that was like, this is what you can do, this is what you can't, this is what's covered, this is what you've used, this is what you have left. I'm like, this is so much easier. Like, I like this. But now I'm definitely hiring one of those.
Because it's just, I mean, I understand a little bit more of it now because I worked at a startup agency, so we really had to try to understand the insurance end of it, so we could then explain it to the people that we were serving, and then now working in it, but like, it's very it's confusing.
Oh yeah.
So I think that would be the big, I mean, you have like your co-pays and deductibles and co-insurance and like all of these words that don't make any sense, but they usually amount to some kind of cost.
Yeah. Oh yeah.
And in-network and out-of-network and like, I just need to go see a doctor. So
Right.
how do I do that?
Yeah. And everyone always wants to blame the insurance company too. I mean, I'm guilty of that. I'm like, it's the insurance company. They said they'll pay this, so that's what the hospital made the price, and now we all have to pay. But it's like, it's just because I don't understand it.
Well, and if you actually will look at a bill, wherever you go for your service, will write up their bill. They submit that to the insurance company.
Okay.
The insurance company says, this is what we pay of this, and then that gets sent back. So the insurance company isn't coming up with the prices for anything, they just come up with what they pay for that service.
Right.
So that's where some of the issue comes in.
Yeah. Yeah, but that's like what I said, it's out of ignorance, like not knowing and just being like, it must be their fault.
And I mean, and you see, and it's still a business. Like when you go see a doctor, it is a business, and like, so like they're supposed to make money. Like that's their job. That's what they're doing. But I mean, when I was at the startup agency that I was working at, like the prices that they were picking for the care that they were going to offer, I was like cringing at. But the truth is they know they're not going to get all of that because then insurance says this is what we're going to pay for. Well, we still offered the service. Like we didn't say, okay, well, we're going to give you like 50% of that service. Like we still gave them everything that they were supposed to get. They pick these higher prices because they know they're not going to get all of it. Because lots of times insurance companies say we only pay 40% of that.
Right. Yeah, it does become tricky. Because then like the person who doesn't have the insurance, that's when they're like, well, but that's when like it comes in, you should have insurance.
Right.
But no, I definitely understand. And like, especially with the Obamacare, with so many people that like they didn't know. I had a friend who worked in a pharmacy at that time, and so many people ended up going with Obamacare because it was like the lower premiums, so they were like wonderful. But she was working in the pharmacy, and she was like, these people who are finally able to afford their premiums can't afford their prescriptions now. And she's like, people I've seen for years that come in and get their insulin, they can't afford insulin anymore. And she's like, what do I tell them? I was like, I don't know. But that's the thing, is just people just don't know. I guess it's just that like fear of not knowing, the fear of the unknown kind of thing. It's a big one, but
Yeah, and I mean, I think Obamacare came in with the right idea in mind, and unfortunately, you don't know mistakes until they start to happen. And I think that's what happened. And then premiums on the insurance rates just started skyrocketing, and then it was like, well, I'm going to get fined if I don't have insurance. I can't afford the price I have to pay right now, though.
Right.
And
you have to like jiggle it, work with it, make it work until it works. But yeah, no, that's definitely a big thing. Is making sure that people understand it and make sure you work out all those tweaks and everything. So I was listening to something the other day where sorry, I was gonna get in the bags. But they were talking about how they were asking if anyone had been on a walk for something versus like something in health. And they were like, well, everyone's been on the cancer walks, everyone's been on like the MS bike rides, and everyone's done that. They're like, how many people have been on like a suicide walk? And I like raised my hand, I was like, I had, and everyone was like, no, like no one had done that. So is that something that you see that could possibly help bring awareness, or that you want to see more of? I know the one I went to was yours.
I mean, I think that's a piece of it. It's again that everyone is going to support cancer. Everyone is going to support the MS. Like everyone's going to support those big things that we know, the March of Dimes, because it's for babies. It's scary to support some of the other things. And I don't think everybody knows about it unless they've gone through it.
Okay.
So like for the suicide, you're never going to see the numbers for those that you're going to see for an AIDS walk or a cancer walk.
Yeah.
Because it's usually for someone who's actually already connected to a mental health provider or who has a personal experience with it that would book it out because they want to be a part of it.
Yeah. There is one I've heard that's advertised. It's like the, is it called the 3-day? Or the 3-night?
The Out of Darkness.
Yeah. So that one I've heard of.
I mean, they're trying to get bigger.
Yeah.
You know, like the National Eating Disorder Association has joined with ARI, which is through American Eagle. So they've partnered with something that has a big name to try to put it out there.
Yeah.
So I mean, I think that that's a piece of doing it, and like ARI has really gone far with, you know, like it's love yourself, love your body. They don't use necessarily like models. They use everyday people.
Yeah.
They don't airbrush, so it's like kind of about being able to really just like show off who you are and having that be like wonderful and accept it, instead of like, okay, here's the picture that we took, but that's not okay, and we're gonna do all of this other stuff to it.
Yeah.
So I think like doing things like that has, because they've partnered with eating disorders, so okay, like now maybe it'll get out a little bit more.
Yeah.
But it's tough. I mean, there are agencies themselves will put on walks and 5Ks or whatever, and you'll see a very small turnout because it's just whoever knows that agency is going to go.
Okay.
Or the county will come in and try to promote it and go out, but.
Nice. I didn't even think of that. Like I just knew that I didn't see a lot of them, and I kind of thought it was just along the same lines as like no one wants to talk about it. If we ignore it, if we pretend it's not there, like then it's not. But I guess it's just not getting out enough. Like the word just not getting out enough.
Mm-hmm.
So you said ARI partnered with them. Do you know if Dove has? Because I know Dove does the whole like embrace your body and women of all.
I don't know if that's like, because I think that's just like their individual campaign. I don't know. But yeah, I know for a fact that Media, which is the National Eating Disorder Association, and ARI have like partnered. So they have like a spokesperson that goes out. She goes to the walks, but like she's also works for ARI and is like kind of up in their corporate.
See, I didn't know that about ARI. I knew when they first started, when American Eagle like started the ARI thing, I was like, oh, I like this. It's not all like the skinny whatever.
Right.
Because especially with me, it was like being short and like having bigger legs. I was like, I can't fit any jeans. And when ARI started and American Eagle like started moving in that direction, I was like, American Eagle jeans fit me.
The only jeans that I can wear.
Yeah, seriously. To this day. It's hard to find them that fit you, but I was like, I love it because they're making a change towards like real people, and now I can fit their clothing. And I was like, I don't care about any other company. I was like, I can't fit them. So.
Right. Yep.
But no, that's really cool. I didn't know that. That's awesome.
Well, yeah. So I mean, I think those are ways to try to bring it into the public a little bit more. But I don't necessarily think everybody. They see the acceptance, which is a wonderful and amazing thing, but they don't necessarily know that there's also this partnership. I know that partnership because I've been to their walks and I've seen them.
And do you think they don't talk about the partnership because of maybe like the walls that people put up, or is it just that it's just not known?
I just think that it's not known.
Okay.
I mean, you'll see like if you follow them on Instagram, like you'll see stuff that they do together. I don't think it's that they're purposely like not trying to do it. It's just
that no one knows.
Yeah, it's just not out
we gotta
there.
get the word out.
Mm-hmm.
But yeah, no, that's what it really is. It's just getting the word out, and I mean, that's what we're trying to do here. I know we probably have a small platform. Everyone share, follow, like, all that. But it is. It's like letting people know about it. It's the same thing as like when I was saying with the commercials, and all you see is like the prescriptions, and you don't see like, go talk to your therapist today. Like, it's just not going to pop up. I was watching a video. I can't remember his name now. I wrote it down. Jeffrey Lieberman, who was talking about how, like, when you call out of work, and would you rather say like you were having like massive diarrhea, or would you rather say you're having like an anxiety attack? Like, diarrhea is pretty embarrassing. I might want to say I was having an anxiety attack.
Yep.
But 9 times out of 10, people will say like the diarrhea, or they'll say whatever physical ailment is going on rather than whatever's actually psychologically going on. And that's the stigma. That's the downside to it. We hide it, we pretend it's not there. I know I've told you about this before, but like so many people that I know, like, they'll have mental health issues and they will ignore it and pretend it's not there until it becomes a physical. And then they go try to seek help, and it's like, we're fixing now something that's not actually the problem.
And most of the time it can't be fixed because there's something else going on. So then you're just like being prescribed different medications to take, and everybody's trying to solve the physical health thing that actually has a different cause. And you're not going to get rid of it until you do something else.
For me, that became really, really, like, I guess, known when I guess it was in high school, and I was leaving high school, and I had started to get blackouts. Like, I had like really bad anxiety, but it was like getting worse to the point where I was like fully blacking out. And of course, parents that did not believe in psychology, did not believe in therapy, they were like, nope, we're gonna take you to a regular doctor. And I went and spoke to like a regular doctor, and I'm like, hey, like, I'm experiencing blackouts. And their idea was to hook my brain up to these like little probes, whatever it was. I said no, so I have no idea what it would have been. But they were like, yeah, we're gonna hook your brain up, we're gonna scan it, we're gonna like let you go through your day, and we'll study it. And I'm like, I'm a bartender. Like, how am I supposed to make money when I have like a head cavity thing on my head? Like, I'm like shooing away the aliens. And then I ended up like completely ignoring it and like acting like it was nothing, because I was like, I don't want to go through that. But it was just because like I just didn't know where to go. And again, they were trying to fix a problem that was psychological with like a physical kind of like, let's study the brain instead of like, what are the thoughts?
And I think that's a big piece. I mean, typically everybody's going to go to their primary care doctor when there's something that's wrong. So that could be like your first line of defense. But they have to be willing to at least have a basic understanding of it and then be able to refer. And I think what happens a lot is they still try to manage it. They are seeing depression and anxiety as real things, and they are trying to treat it from a mental health standpoint, but they're not a psychiatrist. So like, just because you know medication doesn't mean you really know medication. Like, I'm not going to ask a psychiatrist to give me something that I need to take if I have the flu, or I'm not going to go to a psychiatrist to prescribe cancer medication for me. I'm going to go to that specialist. So I think that's the biggest piece, is it's the catch-22. It's becoming more accepted, it's becoming more known, but then we have to get them to the right place to take care of it.
I have a friend who works in a hospital who's saying getting pamphlets is like the biggest thing. And like making sure that everyone that comes in, if like you can't fix the problem right then and there, like making sure they get a pamphlet. Like, my only thing with that is like, I don't ever read the pamphlets. You have to like tell me like this is what, or you have to write it on a, like, if you write it on a prescription pad, I'll read it. If you say it to me, like, I'll listen to it. But if you hand me a pamphlet, it's so like, I feel like it's not connected. It's just like, here's the thing that I give everyone. Do you want it? No. But I mean, it would be definitely a step in the right direction, and like making sure that people who aren't like me will read it and maybe be able to find, better solutions or what they need.
I mean, I think you need to be able to have the time too, and that's one of the biggest issues that you have, is because they're trying to see and help as many people as they possibly can. A practice can only afford to hire X amount of doctors, which means that you're limited to 15 minutes when you're in there with them. So they get blocked with how much they can really go through with you to be like, okay, I hear what you're saying, let's explore it, let's process it, this is where I think might be helpful. That's where those papers end up just coming out. It's like, oh, okay, this sounds like anxiety. Here,
Yeah. That's my big thing. Like, I wish, even if it was just at a primary care physician level, like if the ERs or hospitals, like they needed to go quickly, I would get that. But I feel like if you could at least have more time with your primary care physician, or if they could, like, I don't know, at least, because I feel bad. I want to blame the doctors. Again, I want to blame someone else.
Right, we all, I mean, it's the easiest thing to do. It's
Right.
easier to point fingers than.
But it's like they can't. They're in so much debt after, you know, the years of college and then buying the practice if they have private practice. And then it's like, you know, it's just so much. And then they have to be able to pay all this back. And the only way they can is by, you know, getting that quota. How many people can they get in and out that door? And it's like they only have so many hours a day to be able to do this.
And you don't want to be the next person that's been waiting in the room for 45 minutes
yeah.
because the doctor's been in seeing someone else. So like, it's tough to come up with what would honestly be the ideal.
Like everything would have to change. There would have to be like the universal health care. There would have to be like the universal college so that they wouldn't have these big fees. We wouldn't have insurance companies who were competing with prices, and then everything would be perfect. The utopia of doctors. But yeah, well, thank you so much for talking to me today. I hope that everyone was able to get a little bit more information about insurance. I know that for me, at least, my eyes are opened. Because again, I'm like the one, I'm going to blame everyone. So
we all do it.
Thank you.
Yeah.
And then thank you for this. So you get 30 seconds to a minute to tell anyone if you've got anything going on, any like walks coming up, anything that's you want people to know about.
Oh, I don't think there is anything. This time of year, not too many people are out and about. Usually in the springtime, you'll see a lot of stuff for everything. For addiction, for suicide, for mental health. Yeah, so look in the springtime. Google it. You'll find them. They're all over the place. You just have to look for them.
All right. Bye.